Hello everybody, thanks for joining us for our Moving to Value-Based Care with RScan webinar. Just a couple items before we get started. If anybody has questions, you can type them into the question box and we'll be answering those over the course of the webinar. You can also raise your hand, and at the end, if you have any questions, we can unmute you so you can talk to us directly. Without further ado, I'll turn it over to Dr. Max Wintermark.
Thank you, Zach. Good afternoon, everybody. My name is Max Wintermark. I'm a radiologist working at Stanford University, and I'm also a clinical advisor to RScan. Welcome to our webinar. The title of the webinar is Moving to Value-Based Care with RScan. And today what we're hoping to do with the panelists on that webinar is to give you some information on what RScan is and also on how it works, and we'll illustrate that with the practical example of what has been done at Baylor. So the first thing that I would like to do is to introduce the panelists on this webinar. So our first panelist will be Dr. Lincoln. Dr. Lincoln, do you want to tell us a little bit about yourself, please?
Yes, hi Max, good morning, or good afternoon everyone. My name is Christy Lincoln. I'm an assistant professor of radiology with specialty in neuroradiology at the Baylor College of Medicine.
Thank you, Christy. Dr. Chen?
Hi, I'm Melissa Chen. I was a fellow over at Baylor College of Medicine last year, and I'm doing a second-year fellowship at MD Anderson.
Thank you, Melissa. And Dr. Reed?
Hi, I'm an associate professor in the Department of Family and Community Medicine at Baylor College of Medicine, and I'm also the vice chair for community health.
Thank you, Brian. So thank you, all three of us, for being on the webinar today. We also have on the webinar several ACR staff members. First is Judy Burleson. Judy, do you want to tell us a word about yourself, please?
Sure. I'm Senior Director for Quality Management Programs at ACR. That includes our registries, quality measurement programs, and RScan.
Thank you, Judy. Nancy Fredericks. Nancy?
Hi, good afternoon all. I'm Nancy Fredericks. I'm the RScan Program Director at the ACR.
Thank you, Nancy. And finally, we have Zach. We have already heard Zach at the beginning of the webinar, but Zach, do you want to tell us a couple of words about yourself?
Hi, I'm Zach Smith. I work for the Quality and Safety Department with Judy, and I'm also part of the RScan team with Nancy.
Thank you, Zach. So again, thank you everybody for attending this webinar today. The next slide is going to show you our agenda for today. So first, we're going to discuss a little bit what RScan is and why you should participate in RScan. Then the best way that you are going to understand how RScan works is by looking at a very practical implementation of RScan, and that's why we have our panelists from Baylor who are going to tell us about their experience with RScan. Then Judy will give you some very important information on how RScan basically ties in with the MACRA and the PAMA legislation. And we'll have finally Nancy, who will bring us through the RScan website and also show us the clinical decision support tool, the ACR Select, that is part of the RScan project. And then at the end, we'll have time to answer and address any questions that you might have. So let's start with what is RScan. So RScan, I think that the most fundamental component of RScan is really a collaboration between radiologists and referring clinicians around trying to improve the appropriateness of imaging tests. Really the goal of RScan is to ensure that each individual patient receives the appropriate imaging test at the appropriate time. RScan is intimately linked with the Choosing Wisely campaign. The Choosing Wisely campaign was developed by the American Board of Internal Medicine, and it was done in collaboration with a number of professional societies, and it basically identified a number of tests that are sometimes ordered inappropriately. And among those tests are imaging tests, and that's those imaging tests that RScan is basically focusing on. And RScan, as you will see from the Baylor example, basically offers a process that allows you to tackle those inappropriate tests pertaining to your practice. And it really proposes a framework on trying to work, again, collaboratively between radiologists and referring physicians to try to improve the ordering of those tests. With, again, the idea to benefit each individual patient, but also to contribute to containing the healthcare expenses. The RScan project is funded by CMS as part of what they call their Transforming Clinical Practice initiative. As part of this TCPI initiative, basically there are a number of what they call strategic alignment network that work on specific aspects of medicine, and RScan is one of those networks. And really the goal of the TCPI initiative is to support a very large number of practices, more than 140,000 practices. It's to improve healthcare outcomes for millions of patients while reducing unnecessary hospitalization and unnecessary tests and procedures. So it's basically to control the cost related to healthcare while at the same time improving patients' outcomes. And so we're really excited with RScan that we have a very practical, pragmatic way to propose so that you can tackle the imaging tests that you think are sometimes ordered inappropriately at your institution or in your practice, and giving you really a streamlined way to address this issue and to fix it. And so really, again, a collaborative effort is at the foundation of RScan, and anybody who has the same interest in mind is welcome to participate, independent of their, again, specialty, independent of their level of training, or independent of their background. And again, I think that the best way to understand how RScan works is to dive into a practical implementation of RScan, and we're going to start discussing the Baylor experience. And so I'm going to ask Dr. Lincoln first to comment a little bit on how she learned about RScan and what basically decided her to participate. So Christy, please.
Yes, Max. So that you and the audience are aware, I'm at the Baylor College of Medicine, and we're affiliated with the county hospital system, Harris Health, which primarily provides indigent care to the Houston area. Melissa Chen, our now former neuroradiology fellow, and I decided to do a PQI project that involved improving quality of patient care, especially with respect to radiology reports. And after reviewing the many RScan Choosing Wisely topics, the topic of reducing imaging for low back pain resonated with our practice, as several of our outpatient clinics ordered more lumbar spine MRIs than normal, many of which we suspected were wasteful. So we started gathering the data of our outpatient clinics with the help of our IT department. And then we noticed that there were 2 high-volume clinics in our county hospital which ordered many more studies, which we felt like could be addressed with our RScan project. And so we decided that a collaboration was needed at that point. We also were under the impression that the county hospital was also monitoring closely the number of studies that were ordered by clinics and by physicians. And so that increased our motivation to work with them. And so just to get the project off the ground after we got our data, we reached out to Dr. Brian Reed, who's the head of the outpatient clinics and community medicine, and he himself is a family medicine physician. And so when we approached him, he was completely supportive of us and the project idea. In fact, we saw it as a constructive collaboration. And so from there, he provided us the 2 names of the directors at the 2 clinics, who were Drs. Lu Fong and Samuel Willis. And when we approached the 2 directors, they were also very welcoming and accommodating at the time of the project proposal. And then when we gave the actual intervention or the educational session, the clinical directors, their physician colleagues, the nurse practitioners, and physician's assistants were very interested in learning about the appropriateness criteria and image utilization for chronic low back pain and the use of RScan. So it was a very receptive group.
Okay, thank you, Lucy. That's great. And so you told us, how you took off the project off the ground, how you contacted the referring clinician, Dr. Reed, and his colleagues to develop that collaboration. Can you tell us a little bit what was your baseline like? What did you do? What, how it worked, and what kind of tool you used in order to conduct your baseline?
Yes, so what we did was we combed through our initial data before the intervention and found that using RScan and inputting our information into RScan, we found that the appropriateness versus inappropriateness of the studies order were about 50-50. And so we thought, given that it was a 50-50, we could try and get it more toward a better percentage of more appropriate studies ordered. So we used RScan in that way in a retrospective manner before our educational session, and we're still currently, after the intervention or educational session, we're still inputting information into RScan. And so far we're getting more of a skew where we're getting more appropriate studies versus inappropriate studies for chronic low back pain.
So RScan is really basically working like a PQI project. You have the baseline, the intervention, and now you're in the post-intervention phase. You mentioned that you had this 50-50 of appropriateness, inappropriateness in your baseline. How did you determine that number? What tool did you use to determine that number?
So we used RScan. So we inputted all of our data from these two specific clinics into RScan, and it inputted all of the clinical information into RScan, and then that's how we got a graphical form through RScan showing us exactly where our clinic stood with regard to the appropriateness of their imaging.
Yep. Okay. All right. That makes sense. And in a moment for the webinar audience, we'll have a demonstration of in RScan. There's one tool which is a clinical decision support tool. It's called ACR Select. It's available for free as a standalone version as part of RScan. And Nancy will give us a demonstration towards the end of that webinar. So thank you, Christy. I'm going to now move to Dr. Reed. And Dr. Reed, so what was your reaction when Dr. Lincoln and Chen contacted you to participate in RScan?
That was fairly exciting. So again, as Dr. Lincoln had mentioned, we are part of a safety net organization in which we have some limited resources, and what we've had is sort of long wait times for patients to get MRI studies done. And we'd had some previous experience with another quality improvement project that looked at reducing the wait time for patients that needed imaging related to osteoarthritis in the knee. So with that previous experience, we actually saw that we had greater throughput for our patients and less wait times for patients to get MRIs of the knee. So we were hopeful that this intervention would help us with similar imaging requests for the lumbar spine or back.
Okay, okay. Was it difficult to convince your colleague to participate? Were they afraid that it would take them too much time or effort, or what was their reaction?
No, it was very positive. It was a very collaborative effort in which a team of radiologists visited our centers, provided some educational information regarding when to order different imaging studies and what types of patients would be most appropriate for an MRI, and basically what we would do with that information afterwards. How would it change the treatment plans for them? So once we were reassured that this would be the best evidence and the best approach to the clinical problem that we were trying to address, I mean, we were pretty open to changing our practice style.
How do you think that RScan addresses the growing emphasis on quality-based reimbursements?
So, I mean, that's a great question. We, in our organization, again, because we are sort of limited in terms of our funding, we've actually had some financial hardship in the last 2 years. So we have to be pretty attentive to our sort of fiscal management of resources. We want to reach out and serve as many patients as possible, and if we're overspending and ordering inappropriate tests, that's harmful for us. So we're an organization that's focused on achieving the triple aim, and that's improving the patient experience of care, improving the health of the communities, and also being attentive to the per capita cost. And I think that this intervention has really sort of helped us achieve all those goals. Patients were pretty dissatisfied when we, say, okay, you have a back pain, and our management plan includes getting an MRI, but it's so many weeks or months away because we've got the queue of patients waiting with a bunch of studies that really aren't indicated or aren't necessary. So this has helped, at least for the inpatient, they get the study done in a more appropriate time, or if they don't need it altogether, then we're able to go ahead and proceed with getting them into physical therapy or some other treatment modality without sending them for an unnecessary imaging study. And then we're thinking that our outcomes will be better, and again, we're saving money for the system.
Thank you, Brian. I think it's great to see the buy-in of your group in the RScan project. So I'm now going to turn to Dr. Chen to ask her a little bit from a radiologist perspective. What do you think, Melissa, were the most significant benefits that you realized from participating in RScan?
Well, I really wanted to get engaged in the QI project fairly quickly, and to kind of get that up and going, it takes a lot of time and effort. And the RScan platform really makes it easy to fulfill this. There's a lot of resources provided, educational materials that you can leverage off of to engage with other clinicians. And there are a lot of different topics to choose, and a lot of them are choosing wisely topics that many other specialties are aware of, so it's not like you're coming at them blindly. It's something that they already kind of have buy-in because they are aware from their organizations of the same types of topics. And so, we've been evaluating the exam so far and the project that we've done so far, and the results look really promising. And I really see it as a platform to launch many other QI projects or other areas to kind of improve, clinical support for your institution.
Thank you, Melissa. I asked this question to Dr. Reed before, but I want to ask it to you now. As a radiologist, how do you think RScan addresses the growing emphasis on quality-based reimbursement, the shift from volume to value?
I think that was one of my biggest motivations for engaging in RScan, was preparing for the future changes under the Medicare Access and CHIP Reauthorization Act, or MACRA. And I think that it really allows us to understand how we as radiologists can bend the cost curve for the healthcare system. And we can, for example, record value for what we do, even if it's the value of encouraging not to do a study. So I think that this platform is a great way to do that. And also, our group really wanted to show Harris Health and the hospital that we are in, that we are leaders kind of in this area of demonstrating value.
That makes a lot of sense. So thank you so much. So you mentioned MACRA, so I'm now going to turn to Judy Burleson. Again, Judy, as she mentioned in our introduction, is the Senior Director for the Quality Management Program at ACR. And Judy is going to tell us everything we wanted to know but never dare asking about MACRA and PAMA. Judy, please.
Well, sure. I'll tell you everything I can in about 4 minutes. So that's not a lot. But just really briefly, the CMS is implementing the provisions of MACRA, the Medicare Access and CHIP Reauthorization Act, through its quality payment program, coming to be known as QPP. Of course, we have to have acronyms. And under that QPP, there are two pathways: the Merit-Based Incentive Payment System, or MIPS, and Advanced Alternative Payment Models, or APMs. So the MACRA legislation ended the sustainable growth rate formula and brought about change in how payments to healthcare providers would be made, moving towards value versus volume. It created a new framework for rewarding better care at lower cost. And through the quality payment program, existing quality programs that CMS has in place were streamlined into MIPS, including the PQRS program, the Physician Quality Reporting Program, the Value-Based Payment Modifier, and the Meaningful Use or EHR Incentive Program. Those all fold into MIPS. And they, CMS, from the legislation, added a fourth component called Clinical Practice Improvement Activities, which are very similar to some extent, to Maintenance of Certification, Part 4 Practice Quality Improvement Projects. So the four components of MIPS then are quality, which is based on how PQRS is now currently, resource use, which is primarily the cost component of the value modifier program in place now, the clinical practice improvement activities, which is new, the CPIA, and the fourth component being advancing care information, which is very similar to the meaningful use program. So the clinical practice improvement activities, CMS had identified in the MACRA proposed rule this summer that a participation in the Transforming Clinical Practice Initiative, TCPI, would be considered a clinical practice improvement activities. So participation in RScan as a part of the TCPI program would serve as a meeting one of the clinical practice improvement activities under that component. And just a quick reminder of when MACRA will be in place. That's coming about very soon, beginning actually in 2017, since the payment adjustments are, which are to begin in 2019 according to the MACRA legislation, they are based on services provided in 2017. So the quality payment programs are coming about very rapidly and extending through the next 6 or so years.
Mm-hmm. Judy, earlier we mentioned that as part of RScan, the participants have access to this free standalone version of ACR Select, which is a clinical decision support tool. Could you please explain to us how those clinical decision support tools fit into what you describe, and also PAMA, please?
Sure. So PAMA is legislation that was enacted in 2014, Protecting Access to Medicare Act. And in general, that legislation requires that providers ordering imaging consult appropriate use criteria prior to ordering advanced imaging exams. And this will be a requirement for reimbursement to the rendering provider of imaging or the imaging physicians. This legislation was to have gone into place in 2017, but there has been some delay, and it is looking like that it will be implemented in January of 2018. So RScan serves as a real practical way to become familiar with using a clinical decision support tool for to meet the PAMA legislation, but to start using that within a practice and working with referring clinicians. The RScan provides an electronic version of ACR's appropriateness criteria through the ACR Select portal. But for practices that already have clinical decision support installed, they may have it integrated into their EHR. RScan is now acting as a sort of a pilot for tracking adherence to appropriateness use criteria.
Okay, thank you, Judy. So that's a great introduction and a great segue to what Nancy is going to talk about now. You have heard about RScan, you have heard about the website, about this clinical decision support tool. So now Nancy is going to give us a very practical demonstration of the website for RScan and this clinical decision support tool. So Nancy, please.
Thank you, Max, and good afternoon, everybody, again. I'm going to take you quickly through some of the key components of the public-facing website, and then we'll log into the password protected section and show you some of the tools that Dr. Lincoln and Chen were discussing earlier in the program. But to get started, I'm going to just kind of go over quickly the steps for participation. The first step actually is to pledge. We have a simple pledge form on the home page, and really this allows us to show Medicare that we have radiology practices and referring clinicians who are interested in engaging in RScan, as we have described in our project grant. So then the next step is to select your Choosing Wisely topic. At Baylor, you heard that they selected the low back pain topic. Right now we have 11 topics that are part of the RScan program, and we're adding to this list regularly. I'm just going to scroll through these slowly to give you an idea of the topics that are available. And actually soon we're going to be adding an upgrade that will allow sites to customize their own topics. So look forward to sharing with our community more about that when that's available, probably sometime in the next couple of weeks. So then you have your topic, and then you identify your collaborator. Again, just using the low back pain topic, often that would be with family medicine, or could be even with emergency care clinicians. And then, as Christy described, you identify your cases retrospectively, and it really depends upon the number of clinicians you're working with. If you're working with a small group, then perhaps you would want to retrospectively review 25 to 30 cases. If you're working with a larger group, perhaps you'd want to review 75 to 100 cases. So it's really up to the practices to decide the number of cases that would be meaningful for their particular collaboration. And we'll show you in just a minute, but as was described, we're using ACR Select as the rating tool because ACR Select represents the electronic version of the AC appropriateness criteria, whereas in real clinical practice, ACR Select would be used at the point of ordering to help guide referring clinicians. In our instance, we're using ACR Select to retrospectively evaluate cases. And as we've seen across many practices in RScan, that collecting and evaluating that baseline data has resulted in an indication that there's an opportunity for improved ordering, and that's where the educational program takes place. And as Drs. Lincoln and Chen mentioned, we've got a number of educational resources, some that have CME attached to them. We have topic-specific resources, and also just general resources. We just recently, for example, completed a module on clinical decision support with the AMA that you can find as part of their Steps Forward program. So we continue to add to our archive of educational materials, and actually it's been great to get contributions from some of the RScan participants as well. So you carry out the educational program, as we heard Dr. Reed discuss a little bit more, and then you wait some time and again go back, collect cases, and rate those cases with the goal of demonstrating that through the collaboration with the referring clinicians and the radiologists that patients are receiving improved care, improved imaging care. So that is the overview. Just to confirm, again, we have our resources. We also have some information, some videos that you could use in your collaboration. So now we're going to go to the password protected requested section, and actually the RScan team can provide usernames and passwords to all participants, the radiologists and referring clinicians to this section of the website. It's very easily accomplished. So the first thing that would take place would be to register for a topic. Here are all of the Choosing Wisely topics. Here's the low back pain topic that we've heard about today. Just quickly, all that's required for registration, we ask that there be a lead radiologist and a lead referring physician to demonstrate that collaboration is taking place. So pretty simple registration form. And once you register for RScan, then that will prompt the data entry screen to show up here. And actually I've registered for all of the topics as part of demonstrating RScan, but if you just registered for the musculoskeletal topic, this would be the only component that would show up under enter cases. So now I'm going to demonstrate how to enter data using the ACR select tool. So let's say you have your 25 cases, maybe you're sitting down with your referring colleague to look at these cases together as part of the educational opportunity. You click on Enter Data, and this is taking me directly into the clinical decision support tool. So let's just do a quick example. Let's say we have a 29-year-old male. We're going to be looking at a case that relates to the spine. We simply enter in back, and then up pop all of the different clinical scenarios related to back imaging. And the scenario we're looking at for RScan is low back pain with no prior management, no red flags that suggest that imaging should take place. So you can see here that once you select that indication, that it brings up all of the possible exams one might consider for this indication. And for this particular indication, we can see that no imaging performed receives a 9, which is a high score, and that if imaging was performed, these receive lower scores. So I'm going to just do an example of a high score. It's like no imaging was performed. Okay, that's very quick. And now we'll do an example of a case where imaging was performed. Let's select female. Okay, again, put in back. We'll look for our indication. So this time we have a case that there was a CT that was performed, even though it probably was not the best study to order for this particular indication. But because we're rating this, we're going to proceed with the exam. And maybe it was the patient preference that a patient was quite insistent on receiving a CT. You can track some information here if you care to, or just simply put NA. So really what we're doing by entering these data into RScan is we're putting the data into the practices database that's part of the RScan database, and that's how we generate the reports that Dr. Lincoln mentioned earlier in the presentation. And so as you enter data, it's being again put into the database, and then the database creates these reports. So for this particular, as I've been entering data, we can see we have baseline data, quite a few in my example practice, quite a few inappropriate exams being ordered. Here's a summary of the total number of exams ordered, the average appropriateness rating. You can see that there's room for improvement. And then after the educational intervention, when you're again entering data, we can see that many more appropriate exams have been ordered than inappropriate. Here's just a couple other ways of looking at that: the average appropriateness score, the percent exam not usually appropriate. So we can see baseline, it's gone down, and average appropriateness score has gone up. Also, we list out all of the cases here for review. And multiple people can enter for one practice. Multiple people can enter data, and they can see their own individual report under My Report. If you want to see all of the data from a practice, you can just simply click on a summary report, and you can see all of the data that members from a practice have entered for that particular topic. So you enter your baseline data. You, when you've completed, you simply check off the complete button, and then that will activate the enter data for your post-education project. And the education button will take you back to our resources page to look at the various materials that might be helpful for your particular project. And also behind password protection is access to a variety of free CME that when selecting any of these products, it will take you right to the CME source where you'll be able to order them and receive instructions about how to carry out the CME activity and receive credit. So the other thing that I want to point out on this page is that we have just a practice section with ACR Select that allows clinicians to just try out ACR Select without actually entering data into the particular project. So again, it's by clicking on Enter Data, you just access ACR Select and then can try any number of various indications and scenarios. Just a good opportunity to introduce clinicians to clinical decision support. So that provides a quick overview, and Zach, you can return to the slide presentation.
And while Zach is doing that, I just want to insist on one of the things that you say, Nancy, which is basically that the participation to RScan is free. There's no cost associated with RScan. You need indeed to create an account, but again, there's no cost associated with creating an account, and you don't need to be an ACR member to create an account. So I just wanted to make that clear before we go through the next steps and we start listening to questions from the audience. So Nancy,
Okay.
do you want to quickly talk
Sure.
about the next steps?
Sure, and thanks, Max. I think that is an important point, that there is no cost. Thanks for bringing that out. So next steps, the RScan team is very anxious to work with individual practices to help them select topics, create collaborations, provide trainings. So we hope that you would feel free to contact us for support to get started, and along the way we've got a number of outreach materials. I'll just take a moment to mention in particular we have materials that discuss our collaboration with the American College of Emergency Physicians. They are also part of the Transforming Clinical Practice Initiative and are working on many of the same imaging topics that RScan is. And so if you'd be interested in working with colleagues in the emergency department, we'd be happy to share that information with you. We can attend trainings that sites might be hosting, and just again provide assistance along the way. So you can easily get in touch with us just simply at rscaninfo.org. So would really look forward to hearing from participants on today's call.
All right, thank you, Nancy, and thank you again to all the panelists. So now I think we're ready to take questions from the audience. So Zach, can you remind us how a member of the audience can ask a question, please?
Sure. Everybody can either type a question into the question section of their GoToWebinar toolbar, and we can read your question out loud, or you can raise your hand and we will unmute you if you're on the phone and you can ask your question directly. So I can read some that we've gotten over the course of the webinar because we got a couple good ones that might be worth talking about.
Zach, just as a, how do you raise your hand for those of us who are not IT savvy like you are?
There should be a little hand icon that you'll see in your GoToWebinar toolbar. If you just click that, then we can see that your hand is raised. Okay. And we'll let you know when you can talk.
All right, so let's start with the questions we have received already.
So here's the first one. Decreasing inappropriate imaging is everyone's goal, but runs counter to our legal environment. How will any of this really work without a change in our litigious medical system?
All right, so that's a great question. Any panelists who would like to address that?
We gave an initial response to that, but perhaps the clinicians can build upon the answer. Primarily that the basis of improving appropriate imaging ordering is using evidence-based guidelines, and those guidelines should support clinicians in a legal situation.
Christy, Melissa, or Brian, anything you would like to add?
Yeah, this is Dr. Reed. This is Dr. Reed. I agree. I mean, what we've seen in terms of how we say are inappropriate are those who would be patient being referred for an MRI of the back without any sort of red flag symptoms. I mean, or maybe they've had back pain for just 1 week. They don't need to jump to an MRI. But we had that happening with some of our practitioners.
And I think perhaps what I want to add along the same lines is that indeed, to take the example of back pain, there are also some downsides of jumping on the MRI. First, it's going to not necessarily make the patient better. There may be some incidental findings that may lead to other unnecessary tests or to some complications. And there's definitely a cost for the patient associated with those unnecessary tests. And one of the tools available on the OurScan website for the low back pain topic are consumer reports brochure explaining those very facts to the patient. So I agree with the question that there are some topics where it's probably more complex, but for a number of the topics, I think it reflects this need to better educate our patients on what they can realistically expect from the imaging, and the fact that imaging is not always necessarily going to help them be better. All right. Any other questions, Zach? Or any comment from Christy or Melissa?
Yes, Max. This is Christy Lincoln. I just wanted to say that, and I agree with you, that there are certain choosing wisely topics where educating our providers and even the patients with regard to the appropriate study is basically using the evidence-based data. So I think that, as far as litigious scenarios, I don't think that, I think because it's all evidence-based, there is a backup for those particular instances.
Mm-hmm. Okay. Zach, any other question from our audience?
Yeah, I've got a couple more. One was, is OurScan available as an app for smartphones for the clinician to use more easily? And I did answer that one already. We don't specifically have a downloadable app to use, but I have noted that it works just fine on an iPad, so that's pretty handy. The ACR select functions are totally there if you're using an iPad. It isn't really conducive to working on a smartphone, though. And I don't think we really have plans to change that in the future, unfortunately.
Mm-hmm. And again, perhaps here the only thing I want to add is, again, you don't need to have ACR Select to be able to participate in RScan, because again, as part of your participation to RScan, you are given access to a free standalone version that, again, as Zach mentioned, can be accessed on a computer or a tablet, perhaps not a smartphone, but a computer or tablet. And also, as Judy mentioned, or Nancy mentioned, I don't remember, if you already have ACR Select, then there's also a different way that you can participate in RScan and just use the ACR Select that you have. If you have other type of clinical decision support, we are working on also being able to integrate those in RScan. All right. Any other questions?
Another person asked, did I hear correctly, you do not have to be an ACR member to use? And I answered that's correct. You don't have to be an ACR member. You don't have to make any sort of payment to us to use RScan. The only thing that you have to do to use RScan is just create a free login on the ACR website. But that's 100% free. You just have to make a username and password. You don't have to enter any payment.
Mm-hmm. And Nancy, from the same perspective, so again, no fee to participate in RScan. Once you participate in RScan, you can access to this free standalone version of ACR Select. Nancy, do you want to comment also on the free CMEs and all those other small perks from participating in RScan, and also perhaps the MOC?
Sure, thanks, Max. A couple of points too, that if for instance, if there is a large group of referring clinicians who would all like access to the ACR Select tool, we can easily create usernames and passwords for those clinicians. And as Dr. Wintermark is mentioning, that RScan is approved by the American Board of Radiology for MOC Part 4, and also more recently by the American Board of Internal Medicine for MOC Part 4. And right now we have a number of CME products that are available. We're really excited about some upcoming materials that we'll be adding this fall. So I think that it's just another incentive, and these CMEs are available both for referring clinicians and radiologists. So anything else, Dr. Wintermark, you can think of that we should be mentioning in terms of participation benefits?
Not at the moment. Again, I think we discussed a number of them during the presentation today. Our Baylor colleagues highlighted the benefits for individual patients, the benefit also for the practices of the institutions in terms of being more efficient and more cost-conscious. I think Judy mentioned this exposure to clinical decision support and being ready for PAMA and MACRA. And we just discussed the MOC Part 4 as well as the CME credit that you can get for free. So I think those are the main things that come to my mind.
Great.
Any other questions from the audience?
We don't have anything else right now, and nobody's raised a hand, so maybe we could give them a few more seconds if anybody has something.
Christy, Melissa, Brian, is there anything else that you would like to mention about RScan that we didn't get a chance to discuss so far?
I did forget to mention that we don't have ACR Select or RScan incorporated into our EMR, so this was done just as a completely just where Melissa and I had registered with RScan, and in fact we included Brian Reed on RScan when we did register. So we had a family medicine doctor involved in the inputting.
We do have one more question here, or a couple more actually. How much IT support is necessary, and how much staff time is required to participate in RScan?
All right, so Christy and Melissa, do you want to address this question?
So in terms of, for us, because we didn't have clinical decision support, I think that the bulk of the time that we spent was probably inputting data. But, you know, I would say, just to give an estimate, I probably spent entering 20, like say 20 studies. It might take me, I want to say 20, 30 minutes, probably just kind of doing a quick chart review to try to see the reasons. But in terms of, you know, when we presented to the clinic the educational materials, we did it during a lunch hour that the clinics already had set aside either for CME, or they, you know, had a monthly or weekly quality meeting, and so we were able to just kind of stop by the clinic and give a quick presentation. And that part of it was pretty quickly. It didn't take us too long to put together the presentation because there was already material available, and we just kind of supplemented with some of our own information. So, you know, I think that with the integration of, you know, the availability of if someone has ACR Select already and having the automation going into RScan, that would definitely take a lot of the time away. You know, that's probably the most time-intensive portion of the project.
Mm-hmm. Thank you. Perhaps what I want to add is, you know, we have a number of practices and group and institutions across the country participating to RScan, and that has usually been their experience. So everything has been done and designed in RScan to be streamlined and to really limit the amount of time required from the participants. So the fundamental structure is that of a PQI project. But again, everything has been made in such a way that your participation is streamlined and your effort minimized as much as possible. There's still some work that is necessary. But again, you know, for the entering of the data, you have seen the system that Christy described and that Nancy demonstrated. It's pretty slick, pretty fast. The graphs and all the summary material is prepared automatically for you. In terms of the education, as was just mentioned, there's a lot of material available on the RScan website that you are welcome to reuse. You can of course add your own, and the post-intervention phase is very similar to the pre-intervention phase. So some work is needed, but overall in the grand scope of things, much less work than what you would typically spend for a typical PQI project, because again, a lot of the work has already been done for you.
And I'll also add to that, Max, that just talking with sites across the country, it's really been interesting to see the people involved in helping with RScan, from technologists to residents and fellows, and you know, so we've had a wide spectrum of people who have been and are encouraged to be involved in RScan. So it's really dependent on what works for any particular site.
And again, the RScan has been adopted both in academic practices but also in private practices. So it really fits for both. Zach, any other questions for us?
Nope, that's all we have.
All right, so I would like to thank again all the panelists for sharing your experience and all the information that you gave us on RScan. And I want to thank the audience for attending the webinar. And again, as Nancy mentioned on her last slide about next steps, we hope that we will have convinced you to participate in RScan. And if you have any questions, if we can provide help in any way, just contact us at rscaninfo.org. and we will be very happy to oblige. Thank you for attending, and I wish you all a very good day.